Smoking, tobacco use, and e-cigarettes remain major global public health concerns and are leading causes of preventable diseases and death. Despite widespread awareness of their health risks, the highly addictive nature of nicotine keeps many users dependent of these products. E-cigarettes are often viewed as a safer alternative to traditional smoking, yet this misconception has contributed to their growing popularity among young adults. Dental clinicians play an essential role in addressing nicotine use by educating patients, offering cessation counseling, and connecting them with effective resources. However, research shows that dental providers remain among the least likely health professionals to engage in tobacco cessation counseling. By incorporating structured, evidence-based interventions, dental hygienists can help bridge this gap and support patients in overcoming nicotine dependence. Today, we will demonstrate 3 effective treatment strategies for e-cigarette and tobacco users. These strategies will include the 5 A's intervention model, medical referrals for nicotine replacement therapy, and a telephone quitline support. These approaches empower both the clinician and the patient to work collaboratively toward tobacco and nicotine cessation.
Okay, everything looks good. And your hygienist will be right with you, okay?
Thank you.
Okay. Hi Jessica, my name's
Hi.
Kate. I'm gonna be your dental hygienist today. How are you doing?
I'm doing good. How are you?
I'm good. So before we start today's appointment, I would like to review your medical history. Do you have any medical condition I would be aware of?
No.
Do you take any medication or vitamin?
No.
Do you have any allergies?
No.
Okay, now we will go over your dental history. Do you have any dental examination and cleanings on a routine basis?
Yes.
When was the last day of your dental visit?
I think it was a couple years ago in 2023.
Do you remember the name of the dentist or the name of the office?
Yes, it was Pima Medical Institute.
In the past 2 years, have you been experienced any of these symptoms?
I've experienced some dry mouth, some bad breath, sore gums. I think that's it.
Okay. Do you snack with chips, cookie, soda?
I have cookies a lot.
Do you use any form of tobacco?
Yes.
And what kind of tobacco that you use?
I vape. I've been doing it for probably 2 years.
Okay, and I will need you to sign here. Thank you for sharing that you vape. It helps me better support your health. Can you tell me a little more about when or why you tend to vape?
I mostly do it after work every day or when I'm feeling anxious. It just kind of helps me unwind.
That makes sense. A lot of people use vaping for stress relief. I do want to share that nicotine and vaping can increase the risk of gum inflammation, dry mouth, and slower healing after dental work. Cutting back or quitting could really benefit both your mouth and your overall health.
Yeah, I've heard of that before. I just don't really know if I can stop completely.
I understand quitting can be tough, especially with cravings and stress. Have you ever thought about trying to quit or maybe reduce how much you vape?
I've thought about it, but I always just kind of end up going back. I'm not sure if I'm ready yet.
That's totally okay. On a scale of 1 to 10, how ready would you say you are to quit in the next month or so?
Maybe a 6. I'd like to, but I think I'll need some help managing the cravings.
That's a really good start, Jessica. We can support you with things like nicotine replacement and stress management tips. Okay, this is the brochure that will give you more information about disease or what to expect about the withdrawal symptom. And in the back, you can find the website about additional information that you would like to have more. How would you feel about starting by cutting back this week and setting a quit day later on?
I could try that. Maybe cutting down after work would help. I think at my next appointment, I'd like to set a definite quit date though.
Excellent. Let's check it again at your next visit in a few weeks. And you can tell me how it's going. You already take a positive step just by talking about this today.
Thank you, Han. I appreciate that. I'll go ahead and give this a try.
The 5 A's model, ask, advise, assess, assist, and arrange, provides an organized, evidence-based framework for guiding patients like Jessica through behavior change. Studies show this approach increases cessation counseling rates by over 25% and leads to higher success rates.
Hi Jessica, I'm Jose. I'm
Hi.
going to be your dental hygienist for today. So how are you doing?
I'm doing good. How are you?
I'm doing well, thank you so much. So I was reviewing the notes from your last appointment that your dental hygienist discussed trying to quit nicotine with you.
Yes.
And how have you been doing since trying to quit at your last appointment?
It's been a little bit tough. I was only able to quit for a few days. I just don't really have all the support I need to stay strong. There's a lot of pressure from my friends and family because they all share the same habit that I do.
All right, Jessica. So another great support tool is the free telephone quit line. You can call 1-800-QUIT-NOW anytime for counseling, tips, and emotional support. They even offer text reminders and can mail out free resources for you. So this is a great way for you to reach out, and they'll be able to help you out. I also have a card here that comes with their number, their website, and you can just just keep this in your purse or something like that, and just have it ready with you. Okay?
Okay, thank you. I didn't know that existed. Is it confidential?
That's a really good question, Jessica. So yes, it is completely confidential, and it is available 24/7. Many patients say having someone to talk to, especially during cravings, makes a huge difference. And actually, many studies show positive results from patients when trying to quit. So hopefully it will help you too.
Okay, thank you. I'll give that a try and see if I can quit for good this time.
Okay, I'm happy to hear that. Have you tried the nicotine replacements such as lozenges, patches, or gum?
It was briefly discussed at my previous appointment, but I went to go to the store to look for them, and the prices were just a little bit too high for me.
Okay, I understand. Well, another great thing about the quit lines is that they can help provide you with these aids for a lower cost or even for free.
Oh wow, I wasn't aware of that. I'm definitely gonna give them a try.
Okay, well, I'm happy to hear that. That's great that you're willing to try them out. One last thing, do you feel ready to go ahead and set your quit date?
I think with all the additional resources that I have now and the better access to the over-the-counter nicotine replacement aids, I feel more ready to set my quit date.
Okay, that's great. So when would you like to set your quit date for?
I think I would be able to set my quit date for 1 month from today.
Okay, we'll go ahead and set your quit date for 1 month from now and bring you back for a follow-up appointment 1 week after you set your quit date.
Okay, thank you so much for your help. I really appreciate it.
You're welcome. I will reach out to you in a couple of weeks to check in with you on how you're doing with your quitting. I hope you have a great rest of your day, and I wish you the best of luck.
Thank you.
Telephone quit lines are an evidence-based strategy recommended by the CDC. They provide accessible, ongoing support that complements in-office counseling and medical treatment. When combined with models like the 5 A's and NRT, quit lines significantly improve long-term cessation outcomes.
Hi Jessica, my name is Natalia. How are you?
I'm good. How are you?
Good. I'm going to be your clinician today, and I see you're trying to quit vaping. Is that correct?
Yes.
Yeah, and that you've tried a couple things, and I just want to know, how are they working for you?
So I really wanted this to work for me because for the few days I was successful in my quitting, I could really see a change in my day-to-day life and how it felt. I was provided free nicotine patches from the quit line that Jose had provided me at the last appointment. Unfortunately, I have not been successful in stopping because my cravings have been really bad.
Oh, I see. I understand. Is that the main thing you're experiencing, just the cravings
Yes.
part? Okay, I see. I mean, that's very common, actually. I actually relate because I remember my grandma trying to quit many years ago, and it was hard. Especially because my grandpa was also smoking, so it was difficult to just remove herself from that environment. So I understand. I saw the notes for all the other strategies. I'm sorry that they're not working, super great, but I wanted to propose like next level strategy for you, and one of them is the NRT, but beyond the lozenges, the gum, and the patches, they're prescription medications. Actually, I don't know if you ever heard of anything like that, but they help with those cravings, like more the physiological part of smoking. So is that something that you would be interested or you've heard before?
Yeah, I've heard about stuff like that. I'm just kind of wondering, do they really work?
Yes, so because they are more symptom related, it's not so behavioral, but it is more like what your body will feel, you know, when you stop the withdrawal part of it. There are products. There's one called varenicline, I think. Bupropion is a very common one. They show to really help patients wanting to quit. There's a 15% or something like that, some studies show, in the process of quitting, of success for the people quitting. So if that's something that you're willing to try, we actually can refer you so that your provider, they are the ones that can prescribe. We cannot, but we can refer you to them. So if you're willing to try that, I believe it's a good option for you since you've tried other levels of strategies. And we give you the referral, and you can set up an appointment, discuss the best dosage and just the best plan for you if you're okay with that.
I think that'd be a really good option for me.
Okay. Another thing I wanted to inquire: how are you with taking medications in general?
It doesn't really bother me much, and it's not my favorite thing, but I'm
Okay.
definitely willing to put in the effort if this is going to really help me out.
That's great because that's probably going to be a daily treatment for you. So if we work together with your providers, your other healthcare providers, that is a good thing for you because then you're getting care everywhere. It's not just in one part of your healthcare. So we'll give you the referral, put it in your notes, and go from there.
All right,
Does that
sounds
sound
good.
good?
Yeah.
Okay,
Thank
awesome.
you so much.
You're very welcome.
Providing medical referrals for nicotine replacement therapy connects patients with resources beyond the dental setting. This interdisciplinary approach has been shown to increase quit success rates and reinforce the role of the oral health professionals in overall wellness.
Hi Jessica, I'm really happy to see you back today. At the previous appointment, the 5 A's models was used to structure your quit plan and follow-up. The telephone quit line help you 24/7 professional support along with free nicotine replacement aids. And lastly, a medical referral for nicotine replacement therapy to manage cravings safely. I know the process can be tough, so I'd love to hear what your experience has been like, both the progress you've made and any challenges you've run into. So tell me, how has everything been regarding quitting vaping?
It's been a really tough journey, but your recommendations, resources, and constant support, I was able to make a healthy change in my life, which I've seen the benefits of every day since. I did end up using a medical referral and got a prescription, which I think was the last thing that pulled me through with quitting.
By combining these evidence-based strategies, dental hygienists can play a key role in promoting nicotine cessation and improving both oral and systemic health outcomes.
I'm really proud of you for sharing that with me, Jessica. Quitting isn't easy, and the fact that you stayed committed, used the resources, and even followed up with the medical referral says a lot about your dedication to your health. You're proving to yourself that you can do hard things.
This feels way more doable now that I know there's a plan and support. I'm really thankful that you all helped work with me to find alternative options when one didn't work.
Well, I'm really glad everything has been working out for you, Jessica. If you need anything between now and your next recare visit, please feel free to reach out as needed. I hope you enjoy the rest of your day and continue working hard on your journey. You'll always have our team as your support.
Thank
Great
you so
job.
much.